does this look like or relate to the rural areas? Because like the community that I live and work in, the closest hospital is over an hour away.
Mm-hmm.
You know, and you talk about the behavioral issues. I work with individuals who we've had to send them to the other side of the state to even be to find appropriate community placement because of behavioral issues. How would, I don't even know if you'd know, what would funding look like for those rural populations, you know, or up in the UP too, to address those issues that can't be right now in the community or aren't there?
There's a real focus, and especially from that work group, on trying to figure out how we can strengthen the opportunities for folks to be in the communities where they are, even if they're rural, even if they're small communities. And so this kind of a recommendation it came, I think, with the intention of being able to expand the number of placements in a community, because if all of a sudden, even with the current infrastructure that you have, if you could take an additional set of patients, of clients, of citizens into your facility because you have that ability, then you can provide more care and keep people in their community. The other thing was that with a lot of our foster care and adult foster care right now, those placements, we don't necessarily have a place to keep siblings together. We might have one opening. So you see that as a recommendation that for any kind of residential placements that we prioritize putting siblings together, so reserving 2 or 3 spots in a particular home. So a lot of the intention is to get, I think, to exactly what you're suggesting is a need. The funding will be a question, right? But there was a real recognition that the needs of our more populated and less populated communities are different, and that while we want enough standardization that people who are up north or people who are out in the thumb deserve the same quality of care, deserve the same access to programs, should not get, sort of second-rate support. So we want it to be standardized in that way, but we also want it to be flexible enough to recognize that the needs of a rural community might be different, especially when it comes to some of those placements, when it comes to transportation, when it comes to some of the employment opportunities. So there'll be a focus on, and I think a couple of our pilots in particular will be in very rural areas on purpose to see what those additional supports look like, what those costs, either more or less, how does it actually play out. So